All right, Mr. Silvers, we are live on YouTube now. If it's all right, we'll have Shirley do a roll call if we've got a quorum. Do you want to start with a prayer before the roll call or after?
After.
Okay. All right.
Judge Anderson,
Let's see. Judge Anderson is here. I can see him. He's logged in.
Dr. McFarland,
Here.
Laura Elam, Vesta is here. Dr. Sawyer,
He's logged in.
he is on.
He's logged in.
Okay. Kenneth Ramsey,
Can you hear me now? This is James. Can y'all hear me?
yes,
We hear you, Dr. Sawyer.
Okay, thanks.
thank you. Sarah DeBoard Weddle,
I'm here.
thank you. Dr. Brown,
Yes.
thank you. Ronnie Turner,
Yes, I'm here.
Joanna Gregory,
Present.
thank you. Dr. Breeding is not with us today. That should be it.
How many did you have?
I have 10.
10. All right. And I see that the judge dropped off. He's traveling, so he may come in and out, but we have a quorum regardless. So we're good.
Okay, you ready, Sean?
Yes, sir.
All righty. Well, over at the district meeting, Judge Kelly started those meetings with prayer, and I like that idea. So we're going to start our meeting today with prayer, and I'll lead us. Lord, we thank you for this day, for the blessings of it. It's your day, and we'll rejoice in it. And we just ask God that you would bless this group of people that oversee the health department's business. We ask, dear God, that we would do like the Bible says, do it to the best of our abilities. We ask, Lord, that you would bless so many folks around us that have lost loved ones and are hurting. And we ask, God, that you would see fit through the vaccine and other means, Lord, to take this COVID mess away from us. We ask, Lord, your blessings upon this day and each family represented here. In Christ's name we pray. Amen. Well, welcome Joanna Gregory with us today. She's graciously accepted the invitation to be on this board in Greg West's resignation. And we're glad to have her with us today. And you have received the 2020 minutes in the mail. And I will entertain a motion to accept those.
This is Kenneth. I move we approve.
All right. Second.
Second.
Did somebody second that?
Yeah, Joseph Brown.
Joseph Brown seconded the motion. Those in favor signify by saying aye or raising your hand if you're on video.
Aye.
Any opposed? There will be none. Those minutes will stand approved as read. And we will entertain old business. Does Shirley or Mike, either one, have any old business or anyone else?
I don't.
Sean, you got any?
No, sir.
No, no old business? No one has any old business? All righty, there's no old business. We'll pass on to new business. Does anyone have any new business we need to discuss?
I don't have anything other than what's listed on the line items of the agenda, so no. Unless someone else does.
All right, I'm assuming the carpet and stuff like that will come in there then.
I'm sorry.
I'm assuming the carpet bids that we have will be discussed at that point, not now.
Yeah, when we get to the budget.
All right, all right. So there is no new business. Now then, let's look at the budget amendment for 2021. And Sean, I'll turn it over to you.
Okay, so let me share my screen so we can all see what I'm talking about here. So for our current budget year, there was one item that we had to take care of, and we wanted to draw that to your attention. It was a fairly large item, so we wanted to put that specifically in the budget, but we had to purchase a vaccine refrigerator, and it ended up costing $5,021. So, it was something that we had to have, and we could have taken it out of the miscellaneous unknown categories, but since it was such a large item, we wanted to specifically mention that we did that and ask you all to approve the budget amendment. So the only thing that changed was that purchase, and you see it changed here at the bottom line by that amount.
Okay. A question about that. Was it a walk-in refrigerator and overlaid with gold? That's a pretty high refrigerator.
I don't know. Shirley, Ron, did you see any gold or anything on it when you got it?
Is that one of the ones that's required for the deep freeze for the COVID vaccines?
Yeah, it's a vaccine refrigerator. We have to keep one large enough to handle quite a volume of vaccine. Shirley, do you want to tell them anything about the refrigerator specifically?
The refrigerator is a larger refrigerator. It has 2 sliding doors, like a pharmaceutical refrigerator.
Okay. Well, that always jacks the price of that stuff up whenever you have to go with the specialty stuff. But I just thought it was a question worth asking myself. It's abnormally high, so that explains it.
I will say, I was going to say, sir, it doesn't make it any better, but that we've had other counties that have now purchased those and different brands. They've all hit around that same cost.
All right, that's good. So, Sean, I'm assuming we need to entertain a motion to amend that budget
Yes,
for that refrigerator. Is that correct?
yes, to include that amount.
All righty. Does someone want to make that motion?
Mike Anderson, I approve.
All right, second.
McFarland.
McFarland approves. Those in favor say aye.
Aye.
Wave your hand if you're on that. All right. Any opposed? And there are none opposed, so that budget amendment does pass. Now then, the next item on our agenda is a tax rate. Do you have anything you want to say about that, Sean?
Yes, please. I'll go ahead, even though technically we have to approve the tax rate before we approve the budget. It never makes sense to me to ask for a tax rate without putting in perspective of the budget. So I'll present the budget and what all we're asking for you to purchase and what we're requesting, and then you can discuss the tax rate that you feel like best supports that. So if it's all right with you, Chair, I'll go ahead and present our 21-22 budget, and then we can do the tax rate. So I've put it on the screen, and you all, of course, everyone received the packet in advance. But this top block of information is how we arrived at our projected opening balance for next year, which is right here. This is the current year budget that we're operating in right now. We have adjusted it some. This is what you approved, but we've got the actual numbers as of December 31st for our checking account in there, and that affected it a little bit. You'll come in a little better at this when you close the year or when you begin next year, however you want to look at that. We don't always spend all of our miscellaneous unknown, and oftentimes you come in better than what we project as far as closing or opening balance. I'll show you another illustration of that in a moment. But assuming we do spend everything, including the miscellaneous unknown, you would start next year at $165,723 of funds available or opening balance. And again, you'll probably come in a little better than that. Currently, your tax rate is 3.5 cents per $100 of property value for real property, and it's 3 cents per $100 of property value for personal property and for motor vehicle. And what we will be recommending is that you leave the tax rate at that, with one caveat I'll mention in a minute. We do show some other options as far as tax rates, just for you to compare. If you wanted to set the tax rate at any level different than what we're presenting, Ron can make those adjustments on the fly and tell us live during the meeting here what the changes of revenues are. But working under the assumption that you're going to keep the tax rate where it is, this is what the revenues would be for next year. Real property taxes would bring in $254,623. And each year I show you how we calculate that. We have a calculation sheet where we pull information off of, went too far. We pull information off of this sheet that's sent to us by the Finance and Administration Cabinet at the state level. This is the same property value projections that's sent to all the taxing districts, the county, the school board, library, whoever taxes. This is what they use. So we pull out the real property and the motor vehicle and the personal property from this, and we put it in these calculation sheets in the right category: real property, personal property, motor vehicle. We add it up, we multiply it by the proposed tax rate. You can see 3.5 cents for the real property and 3 cents and 3 cents for the personal property and motor vehicle. Then we take those amounts and we multiply it by a 95% collection rate to get the projected revenues that we put in to the budget. So again, next year at the 3.5 cents per $100 for real property value, it would bring in $254,263. And at the 3 cent per $100 of property value for real property and motor vehicle, those two would bring in $31,001 and $31,523. We generally collect a little bit of delinquent tax collections. We've projected that at $7,414. There's a telecommunications tax that brings in $3,456, or projected will bring that amount in. And we draw a little bit of interest on our checking account, $217.95. That interest rate's footnoted here at the bottom. We're getting 0.125% on our checking account. Your receipts, when we tally all of those categories together, comes to $327,876.25. When we add that to the projected funds available, it's $493,599, almost $493,600 of funds available for next year. Now, what we're going to ask you to spend next year is detailed below. And again, I'll run through this. If you have any questions about any of these things, you're welcome to ask after I'll run through it, and either me or Ron or Shirley can answer anything you'd want to know. What we're asking to spend next year, each of our 10 member counties pays in 2.8 cents of property value per $100 of property value into our district budget. The district budget is the budget that's approved by the district board or the governing board, and it pays for all of our operational costs, staff costs, benefits, telephones, travel, space costs, and those kinds of things. Most of our cost is personnel related in our agency, 75 to 80%. But that would be $275,544 that each member county pays at that rate, and your all's amount would be $275,544. Under the category of building maintenance and repair, we have landscaping fall and spring, $2,000. We have laminate vinyl flooring for the basement, $5,000. And I've got a note here. Those quotes for that, for the laminate flooring, can be found on pages 4 and 5 in the packet here. We can look at those in a few minutes. Also, we have a category miscellaneous unknown, $12,000. Now, we do put miscellaneous unknown into our budget because we can't line item things that we don't know yet might happen. So if something unexpected happens, we put some money in there to give us some wiggle room to deal with whatever might come up with our building without having to call a special board meeting. When you add those together, the category of building maintenance and repair totals $19,000. Under the category of furniture and fixtures, a desk for the health education office, $1,000. Some office chairs, $3,690. Some chair mats, $540. Miscellaneous unknown, $2,500. That totals $7,730. Under the category of equipment, we have miscellaneous computer and related equipment, $7,450. This is another one of those categories we most often do not spend all of that. That's for, if we need to purchase a computer, or if we have a computer breakdown, or if we have a server go out, or a router, or a keyboard, or just anything that's a printer, computer, or computer related, to cover whatever expenses we might have there. We have to pay $500 a year to have the generator maintained, and miscellaneous unknown under equipment, $5,000, for a total $12,950. And again, any of these miscellaneous unknown categories, if we don't spend it all, it just stays in your budget and will be there at the ending balance of this year or the opening balance of next year. The other charges for next year, the audit, which will be due next year, $1,500. Paying the dues and subscriptions for the board, for the professional associations, and the membership to the state site where we have to post our financial statements, $1,500. Advertising and printing in the newspaper and publishing to that state website our financials, $300. And then, assuming we get to have an in-person meeting next year, $500 for board member expenses. All of those expenditures together for all categories is $319,024. And when you subtract that from the funds we had available, your ending balance would be $174,575, which is actually $8,000 better than you started. So you're projected to end at a small surplus, $8,800. I will show you while we're on the topic of finances, this shows you how you've closed out each year for the last several years. And of course, you had several years there where you were running at a deficit, but I guess it was last year we reset the tax rate, and you've closed out a little better in that 19 and 20. And of course, this year you'll probably close out in that neighborhood too, because we probably won't spend all the miscellaneous unknown. So the other things in there are the two carpet estimates that we put in there, the 3 carpet estimates that you saw. That just went into it's where we got the information to put a projected cost in for the laminate floor, which was right here, $5,000. So anyway, let me pause this and the sharing and see if you guys have any questions about anything that's in the budget before you set a tax rate.
So I have a question. Pull that back up if you don't care.
Sure.
So I'm looking at the lower right-hand corner of that graph there, and it shows that we would have this year a $17,784 surplus.
What you need to look at is the middle column. The middle column is our current tax rate. These other ones are alternative tax rates that we
I
show
see.
you just so you can see different types of revenue. But the middle
Okay.
column is the one that is the present tax rate.
All right, I was confused. All right, thank you.
Sure. Glad to point that out.
So you have that presented to you as the budget and at no tax increase, which is what I think, you know, we've gained money all 3 years, depending on how much extra expense we've had, and we have had some extra expense. We have an extra $5,000 extra expense that still shows we'll have almost a $9,000 surplus. So at this time, Sean, are we entertaining a motion to leave the tax rate at the same?
Yeah, there's one caveat to that though, and this will make it a little tricky. So it's just tricky on how we're going to have to word the motion. So during this last legislative session, the legislature passed a new law, which from a certain point of view makes it look like the health departments are now subject to the compensating tax rate. The attorneys with the Cabinet of Health and Families says that does not apply to the health departments, and the attorneys at the Department for Local Government says it does. So the attorneys from those two cabinets and departments at the state level are sorting that out. Our goal here is not to raise taxes. So, you know, I would propose that when you make the proposal, it would be leaving the tax rate at 3.5 cents per $100 of real property and 3 cents per $100 of personal and motor vehicle property, or to accept the compensating tax rate, whichever one applies to us. Now, my understanding of the compensating tax rate is it's the rate that would, you would set the tax rate at whatever amounts keeps your revenues the same. So we're either wanting to keep the tax rate the same or the revenues the same. So it would just be whichever one ends up applying to us. Judge, does that make sense to you on the compensating tax rate, the way I've explained it? You're more familiar with it. It's brand new to me.
Yes.
Okay. So the motion would be to leave the taxes where they are now or to accept the compensating tax rate, whichever the attorneys end up saying applies to us.
All right, do we have someone to make that motion?
Mike Anderson will make that motion.
All
We'll
right,
leave
and
the
do we have a
tax rate the
second?
same.
Tax rate.
Kenneth
same.
Ramsey, I'll second.
All right, Kenneth seconds the motion. Those in favor, say aye or wave if you're.
Aye.
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 Is there anyone opposed? All right, so just for clarification, our tax rate will stay the same on everything, and unless the attorneys deem it has to be changed, which we have no control over, correct, Sean?
That's correct. They're trying to interpret right now whether law applies to us or not. We usually take our lead, of course, from the Department of Public Health, and they're the ones who promulgate our administrative regulations. But, you know, I don't know how the attorneys will sort all that out. Either way, we're going to either leave the tax rate the same or leave the revenue that it brings in the same.
All righty. So that motion passes. The tax rate will remain unchanged. Taxpayers for the county of Wayne will not realize any tax increase from the health department unless the attorneys that powers that be determine otherwise. The next thing, do I have a motion to approve this budget? We actually covered the budget there as we were doing the tax rate, correct, Sean?
That's right. That's correct, sir.
Okay, so we approved the tax rate then, so we now need to approve this budget. Do I have a motion?
That's
It's
correct.
Kenneth Ramsey. I move we approve because we went over the budget and it's very close to what we had last year. In fact, the last 2 or 3 years. And I think the taxpayers of our county would be satisfied with that.
Very good. Do I have a second?
Second.
Mike Anderson. Second.
Mike Anderson seconds the motion. Those who are in favor? say aye or wave if you're on the,
Aye.
all right, and those who oppose, say aye. And there is no opposition. Now then, I guess we need to go, Shirley, are you covering members whose terms expire or who's doing that?
Joy, could I say one thing?
Yes.
I'm also attending another Zoom meeting. It's a 3-hour meeting on budgets for the upcoming year. So I'm going to bow out. I want to welcome Joanna to the board, and I just appreciate everyone for the work. I know it's a high-paying job, but we're glad to have you.
Thank you, Judge.
Appreciate it, Mike. We appreciate it. And I did have on my list to thank everyone for joining us today, to take time out of the day to join us. And my bologna sandwich is not nearly as good as what Shirley usually provides, but this is the way we have to do it now. We'll do it. See you, Mike.
I'm sorry I have to leave. See you.
All right. So we have approved the budget. We are looking at members whose terms expire.
That's correct. And we still have a quorum, by the way.
Yes.
Yeah.
Okay. That would be Dr. Sawyer, Laura Elam, Vesta Edwards, Kenneth Ramsey. And I already have all of those forms completed. And also we've added Joanna Gregory.
Shirley, I think you might have went over the ones that's expiring in 22. The ones that are expiring in 21,
Oh, I'm sorry.
I think's the other half. Believe me, I've made that mistake about 700 times in my 20 years. Don't feel bad. It's Dr. Joe Brown, William Breeding, Sarah DeBoard-Weddle, Ronald McFarland, Ronnie Turner, and Joe Silvers. Of course, Ronnie Turner, I think, is appointed by the fiscal court, so he doesn't really expire until the fiscal court tells him he's off the board. Shirley, one thing, and board members, one thing that's different this next year is we usually have you all fill out a paper form and submit it to the state. The state appoints everyone other than the county judge and the fiscal court appointee. This year, they're wanting us to use a web portal to submit the names of our board members. So what you guys need to tell me is and you don't have to do it right now, but if you're finished serving on the board, let us know. Otherwise, we're going to submit your names again. We of course want you to continue to serve on a past 21, and we'd be glad to submit your names again. But if there's some reason and you don't want to continue to serve, just let us know. You can let Shirley know or let me know. So there's really no action to take on that, Chair Silvers, other than to say if someone doesn't want to serve, they need to reach out to us.
Very good. You guys have heard that. And as Mike says, we do appreciate you serving. And it's a worthwhile thing to do to serve your community. Now then, we'll go to members who serve on the district board. What do we need to do with that, Sean?
All right, so the judge is automatically on the district board. When we say district board, we have a new member, so I'll kind of explain that. The local boards continue to set the tax rate, and they continue to make sure there's enough funds to take care of the buildings and grounds and any special local projects that the board might want to do. But then each of the member counties put certain number of representatives on our district or governing board that approves the big budget, the operational budget, our staff costs and facility costs, and approves grants and does my performance evaluation and things like that. Each county pays 2.8 cents per $100 of property value into that budget too. So it's more than just the county budget you approved. Some of the money goes to fund the big budget or the district budget. The members who serve, the judge is automatically on the district board, and then you get one additional member to serve based on every 15,000 population or segment of 15,000. So you have 20,000, so you would have one additional member for the 15,000. And then since you have another segment above 15,000, you'd get a third member. So you should have 3 members, but presently you only have 2 members. One of your members stepped down, but Joy, thankfully, agreed to appoint himself. He's the chair of the board, and he appointed himself in. Let's see. I was letting somebody into the meeting. When Greg resigned from the board, he gave up his position on the district board, obviously, and Mr. Silvers, as the chair, appointed himself to fill his vacancy for the remainder of the term. So right now, the members you have serving is Judge Anderson's automatically on the board. Dr. Brown is serving on the district board, and Mr. or Chair Joe Silvers is serving on the district board. For the moment, we're meeting quarterly by way of Zoom.
If there's anyone that would like to take my place, I'd be glad to let them do that. Otherwise, I don't mind doing it again. And Dr. Brown, you okay with continuing?
Yes.
All right. So does anyone want to take my place? I'll be glad for somebody to do that if they'd like to. I don't hear a lot of volunteers. So we will entertain a motion to leave the officers as Mike Anderson, Joe Brown, and Joe Silvers to represent us on the district board. Do I have a motion for that?
Kenneth Ramsey, I move we approve those names.
And a second?
Second, Ronnie Turner. I'll
Ronnie
second.
Turner seconds the motion. Those in favor say aye.
Aye.
And
Aye.
those opposed? Anybody opposed? And there is none, so we've got that taken care of. All right, let's go to the directors. No, let's see, we got to do election of officers.
Yeah, your current officers, you're the chair, and the vice chair is, if my records are correct, and Shirley can correct me if I'm wrong, the vice chair is Dr. McFarland.
That's
The
correct.
treasurer is Lori Elam, and I serve as a non-voting member of the board as the secretary.
That sounds good. Has anybody spoken with Laura? I'm assuming it's okay. Is she okay with continuing as treasurer? Have we spoken with her?
My assumption is she would continue.
That's what I was gonna say. I would think she would continue. I talked to her earlier in the week and she was gonna try to be on the meeting, so I think it would still be okay.
All right, very good. And if she changes her mind, we can always go back and change it if she's not agreeable to it. But do I hear a motion to leave the officers the same as they were?
Kenneth Ramsey, I move we approve.
Thank you. And a second?
I'll second.
All right, thank you, Joanna. And rather than everybody saying aye, do I have anybody that opposes these officers say aye? So the consensus is that we will keep those same officers. Now we'll go to the director's report.
All right, and we already had an opportunity to talk a little bit, Mr. Silvers, about the vaccine supply, so I'll just go ahead and jump into that since I know that's going to be a question. Pretty much since March, the health department has been doing almost exclusive COVID-19 work. Now that our cases have dropped some of the staff are being able to roll back into traditional duties, but you know, it's been a real challenge. We of course, you know, we do infectious disease control. That's what we do. We do isolation and quarantine. We do enforcement of public health laws. We do public health messaging. Those are all things that we do. It's just doing it at this magnitude and for this length of time has been very trying. And also, most of what we do enjoys very large public support. You know, everyone pretty well agrees you're not supposed to be putting human waste into the streams and waterways. And everyone agrees that your restaurants should operate without having a bug infestation. But with the COVID stuff, you know, part of the public thinks we've done too much and part of the public thinks we haven't done enough. And it's, you know, it's been a challenge trying to do our jobs on top of the politics and everything that's worked its way into it. But, you know, we've moved forward. The cases right now seem to be declining. Vaccines are flowing into our district and happening. We are getting vaccines now. We're starting to do vaccine clinics. Mr. Silvers and I talked earlier about, it seems that certain counties in our district have proportionally not gotten a proportional fair share of vaccines. And that's true. We know that. And of course, we don't make the decision about how much vaccine comes in. The state gets a certain amount of allocation from the federal government, which they subdivide. And then of course, the federal government is sending some allocations straight to certain providers in the counties. And so there's a lot of different stuff going on. I looked at some numbers this morning, and we're starting to get some feedback now about what's the uptake in each county. And one of the counties in our district with the smallest amount of uptake, when I mean uptake is what percentage of our population has had at least a first dose vaccine. So when I'm looking at the uptake, Wayne County is one of the counties we've had the least uptake. And that's probably because the supply of vaccine hasn't been available in the county. So it's been less convenient to get it. So as a health department, we're the only entity in our 10 county region whose vaccine supply is flexible. And what I mean by that is we're getting 1,000 doses a week, but it comes into our district and we can subdivide it out to the counties from our district level. And I've met with the judges a while back to show them that we were going to try to push it out based on, if your county is 10% of the district's population, we would try to get you 10% of vaccine. So anyway, they were open to the idea of us trying to balance things out. Starting this week, we're going to try to push more vaccine to the counties with the least amount of uptake and the least amount of local resources. So we're going to do what we can with our supply to balance that out. I am aware that the governor will be making some announcements today of some additional providers. I think there will be a couple more providers announced for Wayne County. I know there's a lot more providers that are signed up and would like to be providers. And of course, I don't make that decision, but when more vaccine becomes available and the state reaches out to me, I will encourage them to add additional providers. We certainly won't turn any vaccine away that they're offering us in our district. So it's not ideal. One other thing that I'll report that sounded very promising, the commissioner was going over with us the other day with the projected increase in supply from Moderna and from Pfizer, and with the expected approval of Johnson & Johnson. When we take into account the potential supply of vaccine, it looks like maybe by the end of August that everyone that wants a dose will have had an opportunity to get a dose. So we're talking months. Now, right now we're focusing on the 70 and older, and then we'll focus on the 60 and older. But I mean, we're talking about between now and maybe the end of August, everyone that wants one, we're talking months. So if we can keep people patient and being vigilant with the guidance for a few more months, I think we'll have this behind us. Anyway, let me open that up to questions from you guys about anything we've done or anything you want to ask about vaccines or the disease or whatever you want to know.
Is there any feedback on the antibodies that's being provided by the vaccine?
Well, Dr. Wayman would tell you that the vaccines are effective, and it's very rare that someone who's had the vaccine, both doses, end up contracting the disease. Of course, with any vaccine, there's some small margin of population that it's ineffective against. The Moderna and the Pfizer both claim 95% effectiveness, and from the numbers that we can see at the state and federal level, it looks like when people are what they call a breakthrough case, that they have a case even after they've been vaccinated, it's within that 5% margin of error. So it seems to be very effective. The fear, of course, is that the virus will mutate to the point that the vaccine becomes ineffective. That's why it's really important that we stamp it out sooner rather than later. So it's really important that we don't give the vaccine, they give the virus the chance to replicate. When I mean replicate, I mean spread. So do wear your mask, do social distance, do the things you need to do to keep this from spreading so that maybe we can squelch this before it mutates, start over. I hope that answered your question. I'm not a medical person, but
Yeah, that's
I
fine.
repeat what my medical director tells me all the time.
In conjunction with what Sean said, I was interested myself in this because, you mentioned we have in our county, we have the health department, the hospital, and the schools, to my knowledge, are the people that have received doses of vaccine for use in the county. As of last night, according to the information that I received, in case you're interested, 290 doses for the school, 750 for the health department, 400 for Wayne County Hospital. That's a total of 1,440 doses. Now, I went ahead and just divided that two because it takes 2 doses per person. So that's 720 people in our county, theoretically, that have had option to have the vaccine versus 21,000 people in the county. That's pretty poor as far as I'm concerned. But you put on the flip side of that, and by the way, I do want to compliment you guys there at the health department because I've had a lot of feedback on your website, on your COVID report page. Everybody says it's very informative. It is easy to read. You can pass through the information that you don't want and pull the information that you do want off of it. And I also personally appreciate you guys letting people sign up by phone. Our society assumes that everyone has access to the internet and also knows how to use it. So Kroger Field, Horse Park, Bowling Green, Corbin, Somerset, it seems like a lot of people have been able to drive anywhere from 30 to 100 miles one way to get the vaccine, but they can't get it here in Wayne County, which greatly upsets me. I asked some of these folks whenever I was calling trying to get information why that was, and they said, well, maybe you don't have storage. No, we got 3 people that have shown that they have storage and capable of giving it. And just a whole bunch of hooey, basically, is what they told me. I don't know. Sean mentioned political. Maybe that's it. I really don't know. But I guess what my point is this. You guys, all of your board members, Sean, people that are associated with the health department, whenever you're talking to these people that be, I think this is a joke for us to only have 720 people out of 21,000 people vaccinated by this time. And quite honestly, I know my own family members have driven all the way to Lexington, Horse Park, Kroger Field, and not only that, but they get thrown in with a whole bunch of other people. So their risk of contracting the COVID goes up too. It looks to me like it would be a lot better off for them to give us the vaccine here so that we don't have to go all the way up there and expose ourselves to them. But anybody else got any comment on that?
Yeah, I mean, I share your frustration, Joey. We receive, log, administer, and put vaccines in the registry every single day and have staff that are trained to do that. And the state's plan, unfortunately, was to train a lot of people that aren't used to giving vaccines, to give vaccines, set up new facilities that aren't existing. So it has been frustrating. And I think, Sean, what I would say, I know a lot of that's out of your hands, but I think the plan that you proposed is good because our uptake is probably lower than it should be because a lot of people simply aren't interested in even driving to Somerset, which, doesn't sound like it's far, but when I've told people call Lake Cumberland Regional, within the last few weeks, a lot of people would rather wait until it's here locally.
Yeah, and I see that. My numbers right now, and Joy, for your benefit, what you have calculated is really close to what I've got as far as the number of
That's
people
good.
vaccinated. So, and again, I need to validate these numbers. These are just being pulled out of that federal system. Whenever the vaccine's given, you have to put in your county, and they're starting to give that information back to us so we start analyzing our uptake. I mean, we have some counties in our district with as much as 10% of the population having had a first dose, and some as small as 3%. So, we're trying now with what doses we get to push those to the counties that need it most within our ability to do that. And we'll continue that. Plus, this is going to change. And like I said, I know I feel confident there's going to be a couple more providers announced for Wayne County, either this week or next week by the governor. And so this will be a fluid process, but for our doses, we will do the best we can to try to plug the gaps in the counties in our district.
Sean, you're allocating what the health department has gotten by a percentage basis of the population. There's no other fair way to do that than what you're doing.
That's the way we're going, but we're also now taking into account what percent of the population has taken the vaccine. It's not just, what percent, like Wayne County represents 9.71% of our district's population, right? But I'm going to allocate to more of the vaccine to Wayne County than 9.7% because your uptake is smaller. And that's probably because you haven't had a supply in the county. And until we see that number coming up and balancing out better with the district average, I'm going to try to move the doses to the counties where there's the gap. So I have 3 priorities, and I get beat up for these multiple times every day. First priority is to take care of the 70 and older. Second priority is going to be to take care of the 60 and older. Third priority is going to be to make sure that we try to put our doses in the counties where the uptake is falling behind. Now, why do I get beat up for that? I mean, I'm trying to get it to the 70 and older and then the 60 and older. 60 and older represents 91% of our deaths and 75% of our hospitalizations. That's where we're going to get the biggest return for our investment of time. And that's, we want to take care of the most vulnerable population first. But I'm sure you all understand how this stuff works. There's a parade of people that wants to get to the front of the line. And these people are in some powerful positions, and they have their, politicians that they reach out to, and those politicians reach out to me. And it makes it, I get beat up for this every day for not putting special groups ahead of the most vulnerable population. And, ultimately it may be something I get fired over, but I get fired over it. I'm trying to take care of the people that need it most first and get it to the counties where there's gaps. So I hope everyone can live with that.
Well, we appreciate, what you've been doing. Is there anybody have any other question about the, I will say this, we've at Silver's Hometown Pharmacy, we've been ready to vaccinate since day one, since they announced that we could apply for it and ready for it. But I figure the small businesses will get it about the time there's no need for it, but maybe not. We'll see.
Maybe when Johnson & Johnson opens up, there's going to be more supply than there is providers for sure. And they'll have to expand that out some way. And, I'll always pull for our district. I'm never, I'll do whatever I have to do to make sure not one dose that's offered to our district gets turned away.
This is Kenneth.
Yeah.
I
Yes.
got a question.
Yes, sir.
What percent? I think this would make the numbers look even better than what we've been talking about. What percent of the population doesn't want the vaccine? Because I've had the first shot and I get the second one about the 10th of March or whatever. But I've talked to numbers of people say, I'm not taking that shot. What percent of the population does not want that shot? Do you have any idea, Sean?
No, I mean, just personally, probably 50%. I know the governor's office and the Department of Public Health is hoping for 80% uptake. I think that's a wildly overestimate of who's willing to take it. What we really need is the herd immunity, and between how many people take the vaccine and how many people had the disease and recovered from it, it seems like the mark for herd immunity changes regularly. But if we can get 50% of the population, right now we've had almost 10% of our population who's had the disease. You'd be up to 60%, and we'll just keep working it. At some point, probably pretty soon, we'll have more supply than we have demand, and we'll be trying to convince people to take it. And but it's really important people do take it, because we like I said earlier, we don't want to give this virus a chance to mutate to the point where the vaccine's ineffective, and the longer you let it hang around, the more chance that's going to happen. So,
and along that line, Sean, I would reiterate to people that all of you guys absolutely encourage people to take the vaccine. Put it to them this way. This is the way I put it to myself. Especially if you have any kind of conditions, this virus is it's leaving. We don't know what it does to your organ systems a year later, 6 months later. And with myself, I figure I had a whole lot better chance with a vaccine than I did with catching the virus. So, maybe you can put it to people that way. Which would you rather take a chance on, the vaccine with all the safety that's been developed with vaccines, or you want to take a chance with the virus? But anybody have any other question?
I do, Joey. Has the 60 and over vaccinations already started, or is that like March 1st? It's what I've seen out of the governor's office.
Well, it's a little unclear, the communications. Let me tell you what, right now we're in phase 1A and 1B, which includes the 70 and older. When we go into phase 1C, which as the health departments, we've been told to stay in phase 1A and 1B until we get past the 70-year-old. We don't want them to have to compete with anyone else. So when we start having trouble filling our appointment slots with 70 and older, we'll open up to 60 and older, which is 60 and older part of 1C. But there's so many people that's included in 1C, we're going to target the 60 and older first. And that's the message coming out of the State Department for Public Health is, yes, when you move into 1C, emphasize the 60 and older. If you have trouble filling your 60 and older slots, yes, it's okay to fill the few odd slots with others in the 1C, but the priority is going to be 60 and older when we get into the 1C. I'm not sure how close we are to getting to 60 and older. We're going to schedule more appointments this Monday, and we'll see how easy it is to fill those appointments. If we get to the end of the day and we've got a bunch of appointment slots left over, it'll give us the idea we need to go on to 60 and older. If not, we'll wait till the next week. So, just as soon as we have trouble filling the 70 and older slots, we'll go to the 60 and older. And then when we get trouble filling the 60 and older slots, we'll open it up broadly to the rest of 1C. But when we open it up to the rest of the 1C, I mean, that's a lot of people. And we just don't want the 70 and 60-year-olds having to compete for those appointment slots with so many people. I mean, I know 60 and older represents 91% of our death. So, I don't want them to have to compete with people that represents 10% of our COVID death. So, does that make
Joanna,
sense?
Also, just personal experience, a lot of these other places, Krogerfield, UK, Horse Park, which is Kroger Company, seems like big business. He's been in it big time. They have been allowed, I know people myself that are in the 60 and older class. They call, make an appointment, get in just fine. At Kroger Field up there, they have even made the statement, if you see younger people coming around here getting shots. Don't be alarmed. We're trying to work them in. I'm not sure how they get to work the young people in whenever the folks 70 and older here haven't had a chance to get one yet. But, you know, that's the games that they play. But what I would suggest you do is call some of these other places if you want to and try to get in.
The 1A and the 1B include, any school personnel, first responders, any health related workers. So there are some people that appear young that would be getting it because they fall into one of those groups. But now I'm not saying the system's perfect. I'm not saying people aren't doing all kinds of strange stuff. What I'm trying to do as the health director of our district is emphasize the 70-year-olds, emphasize the 60-year-olds, and try to fill the gaps in the counties. Just try and do the best I can to be as good to our district from a public health perspective as possible. And
that's good policy.
Either.
That's good policy, Sean. Anybody have any other questions about it? We'll move on to Tracy, Aaron, and Shannon Beatty. I think they have a health education update for us. Tracy, Shannon, you there?
Yeah, okay. With our health education, of course, you had some data sheets that are in your packet, which I won't go over all this because it's quite a lot and you've had a chance to look over it. If you go to the second page, this kind of gives a breakdown of Kentucky versus Wayne County data. And you can kind of look and see, where our population has kind of stayed, a little bit less, according to this, a few hundred less. And the income here has improved. Our unemployment has improved. And of course, our adult smoking rates have improved. So we're happy about that. Our adult obesity rates actually have not improved, and our physical inactivity has not improved. And I kind of think the adult obesity and the physical inactivity, those kind of go hand in hand. On the next page, this has our social economic factors. And so you can just kind of look on those and see how we compare as into the data in Kentucky. Another thing that I found that was really, really good was our teen birth rates. They have declined. So that's a really good thing. And we like to see that. Some of the things that we are currently working on, we have our community health improvement plans completed, and they are on our website. And we have been working on our CHIPS and, our community health assessments are on the website. I'm sorry. And we have been working on our community health improvement plans. Unfortunately, those have gotten delayed due to COVID, but we are going to pick those back up in the fall and begin working on those and working with our coalitions. And two of our target health areas that we are going to work on in this community is substance use and obesity. So that's what we kind of, with all of our assessments, that's what our target area ended up being. And also, we get a lot of our data from community county health rankings. And with county health rankings, it will give you an overall rank of how your county's doing. And they base this out of 120 counties. The lower the ranking, the healthier that your community is. And for 2020, Wayne County ranked at a 75. That is good. For 2019, we were ranked at a 91. So our community has gotten healthier since 2019. So that's just kind of basically what I have, what we're doing. With our school programs, of course, we can't go into the schools. So we have had our programs professionally videoed and have them set up on a Google platform. So we're able to get our content into the schools. And so we can still, maintain our grant funding and do that also. That's about all I have. Do you have anything, Tracy, you want to add? No? Okay. All right. Thank you.
Well, thank you, Shannon. Sean, one thing I need to ask about these carpet or flooring estimates that we have here. Do we need to act on those, or did that take care of that whenever we had that $5,000 in the budget?
Yeah, I think for the, generally the board would approve bids and on estimates, we just take the low estimate. So those are estimates. It's a $5,000 project, so it's less than what's required to do the sealed bids. So, generally if it's something that requires a bid, we have the board approve it. And if it's just something that requires estimates, we just take care of it. Y'all are welcome to pick one of them if you want to, but
we'll let you take care of that unless somebody wants to do that.
Ron, am I right about that? Are you listening in? The amount on the flooring at $5,000, that's not something we need a sealed bid on, is it?
It's not, yeah, Sean, I'll default to you on how it has to work with the approval, but correct. That's not a sealed bid. We are required by law to get three quotes over $3,000.
Yeah, so I would call those quotes or estimates, and of course the board would approve sealed bids, but generally we take care of anything that's just requires an estimate. So,
alrighty. Well, we'll let you take care of that. Maybe there's only $100, a little over $100 difference between them, so we'll let you guys take care of that. Does anyone have anything else that we need to discuss? Thank you, Shannon, for your presentation.
Joey, Kenneth Ramsey, I'd just like to commend Shirley and the team there at the health department. My wife and I are both over 70 and we've had our first shot, and the scheduling was excellent. You don't have 25, 30 people waiting to get a shot. That we were scheduled at the time that they set for us. And as we were leaving, the next group's coming, or the next person or two's coming in. They do an excellent job, and I wanted to commend them for that.
Thank you, Kenneth. And I'm glad you did that. I also, Wayne County Hospital did the same thing, and it's my understanding Wayne County Schools did the same thing. Just did an excellent job of administering the vaccines. And again, I have to go back. Whenever our seniors, if they're fortunate enough to get an appointment up north, you go in there and there's literally hundreds of people everywhere. Now they do seem to move people through relatively fast, but you're talking about an hour to 2 hours, and here, 20 to 30 minutes, and of course 15 minutes is waiting after you've had the shot. So we appreciate you congratulating our people on that and giving them a thumbs up, and we do appreciate the good job you guys are doing. Does anyone have anything else they would like to say? Sean, nothing?
No, just thank you all for your service.
Absolutely. Thank you guys. We appreciate it. And hopefully we won't have to meet again until next February. And if you have any questions, feel free to check with Shirley. Shirley, thank you for what you do, getting these meetings organized. And do I have a motion for us to adjourn?
I move we adjourn.
I thought surely somebody wanted to quit. Second. All right. Second to Joe Brown. Thank you, guys. Y'all have a wonderful year, and stay away from the COVID. Get vaccinated if you haven't.